The ste-dorethee long-term care home is one of the hardest hit. COVID-19 has killed 13 people and infected at least 115.
It's hard. It's really hard.
Nurse Sylvie Morin says she's stressed, worried about catching the virus herself or giving it to a resident or colleague.
It's sad because the patients that get it and die, they die so fast. I've never seen it in my profession.
The Quebec government says nearly half of the deaths from COVID-19 have been in long-term care homes. In response, they've started moving healthcare workers from hospitals and clinics into the homes to help.
We know that the most vulnerable to the virus are the elderly. We concentrate our efforts in our residences for seniors.
CBC News spoke with nurses who made that move to the home in Laval. They didn't want to be identified, but said there was little direction, no training, and insufficient protective equipment. One described being in a room with 20 infected residents, with instructions to simply try and keep the patients alive. Another described the situation for patients as inhumane. Morin says staff are working in an environment that is far from normal for everyone.
We can't give our best. It's too much. We have too much to take care of. It's really a hard situation.
In a statement, the health authority said there is enough protective equipment for staff and now a team in place to make sure prevention measures are followed. Today, the government said it's ramping up its response with widespread testing at its long-term care homes.
And we're going to test everybody. We're going to test the seniors, we're going to test the staff to make sure we know exactly where people have the COVID-19.
The sirens blaring here this afternoon were a show of solidarity from police and firefighters.
We're not giving up. We try to encourage ourselves.
Those inside this home struggling to contain the virus. Alison Northcott, CBC News, Montreal.